Sir, let's start with the situation. Kasi, well, kanina we opened sa big story with scenes from Cebu. We're talking, of course, about going back to ECQ, and then backdrop dito, DOH is also saying, nako, baka tumaas. Let's brace ourselves, tataas ang cases, ang active cases sa Metro Manila. How prepared are we, sir? Kamusta ang mga ospital natin?
Thank you, Robbie. I think we all know the perspective here in terms of the gradual increase of this COVID-19 new cases and the active cases. If you take a rundown in terms of the whole Philippines, you'd see that there is an increasing trend, a steep increase in the Luzon, and of course, there's also an increase in the Visayas region, and there seems to be a plateau somewhere in Mindanao, but still very high. Regions 1 and Regions 3 and Regions 4A, together with NCR, Regions 6 and 7, this had shown a steadily increase. In fact, in the NCR, we've seen a steep increase coming from 2 weeks. 2 weeks ago, the NCR was just accumulating 600 new cases per day, but now we've reached, to this date, we've reached 1,007 in a day's time. So in other words, there's really a big jump, and this is worrisome because we're dealing here with a different kind of beast. This is the new coronavirus, which is highly transmissible, and we really need to do some preemptive actions, so that we can control the transmission and, of course, not overwhelm our hospitals. In terms of the healthcare utilization in the Philippines, we're still in the low-risk position, but however, in the intensive care units across the country, it is now almost 57%, and this is nearing the threshold of moderate increase or moderate risk. So here in Metro Manila, we're still in the low-risk position from the health capacity utilization rate, HCUR. However, the intensive care unit is also, or the ICU rates are going up. This is also within the range of 56 to 57%, slowly, gradually increasing. So this is a bit worrisome because the steep rise might make the capacity of the hospitals not able to cope up with the number of new and active cases around.
What do you think will be the impact of the ECQ, given that it will only run for 2 weeks? Malaking tulong na ba yun, sir?
Right. The impact of this ECQ basically is just to prevent transmission. In other words, we have to decrease the mobility and and the aggregation of many people to produce super spreader events. And lessening that would mean that it would lessen the transmission, because the virus behaves in a very linear fashion. It just looks for a host. That's what it does. So the only way that we can do this is to prevent this virus from seeking a host, replicate, and mutate. And the thing to do here is to be very aggressive in terms of your community quarantine, so that people will now not move around, and making sure that the transmission is decreased. Also, with the 2 weeks program, we can easily ramp up the vaccination. You know very well that the pillars here really is on prevention and the scaling up of the vaccination, because this vaccination will really produce the protective wall of the community. So these are, I think, the necessary things that we have to do in these 2 weeks. And if there is an increase or it depends on the trend that's happening in the next 2 weeks, it could either de-escalate or escalate. But the thing is, we have to take this ECQ position to make sure that we can lessen the transmission.
How about compared to the surge? I'm asking about the surge. Ito lang na March and April. Yun ang sinasabi ng mga negosyante. Is there any significant improvement in our capacities for...
Yes, ma'am. Yes, ma'am. Of course, yes, ma'am. In terms of the capacity, since last year, we had our lessons in terms of the health capacity and the system, the health system here in the Philippines. We knew very well that we didn't have enough infrastructures, especially here for Metro Manila. And last year, we were only dealing with about 730 intensive care units, basically for COVID. So we really decided to ramp up the intensive care units because basically that's what the critically and severe cases would need, and definitely would also impact on your mortality or case fatality rate. So we actually improved in terms on the improvement of the infrastructure by making more ICU in different hospitals, allocate more, and also transforming some of the rooms into ICUs to cater to this kind of patients. So we did the ramp up, and we have a total right now of almost 1,230 ICU dedicated for COVID here in the NCR.